Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to talk about the Berg balance scale. I've also seen it called the Berg balance test.
Sure.
We're going to go through it, developed by Berg. We think she's from Canada because the first time I saw it published, it was in a Canadian journal. So, A.
I think she's a little German though, but maybe not.
Berg, yeah, that Berg could be. All right, let's go ahead and get started here. What do you need for equipment first, Brad? Let's go over that.
Sure.
You're going to need some type of stepping stool, which you can't see right now, but like usually with a 6-inch step. You'll see that a little later. You need a chair with arms, chair without arms. You need a slipper. You need a stopwatch. And you need a ruler taped to the wall, which we're going to reveal later. All right, let's go ahead and get started, Brad.
Okay. With
this equipment, and there's 14 different steps we got to take here. And we're going to start off with number 1.
And this is going to reveal your risk for falling.
Your risk for falling, yeah. Did I even say that? This is a test. By the way, this is a test for measuring your risk for falling. We use it a lot on the elderly, don't we, Brad?
Yeah.
And it's very good at picking out details on someone who might fall.
Right.
We'll show you that at the end.
Whether you need a cane, a walker, wheelchair, it can help that out.
Right, it can bring that down. All right, the first instruction is you're going to start with a chair with no arms. I want you to go ahead, please stand up and try not to use your arms for support.
Okay, so my hands will be here.
Right. And the score is, he gets a perfect score of 4 points if he's able to do that. Otherwise, there's different variations of that. You can read those on the test. Now the next one is standing unsupported. So now Brad, you could have stayed standing actually. And stand for 2 minutes without holding on to something. That's where I'd use the stopwatch. And I would time him. Obviously I'm not going to go for 2 minutes. And if he needs supervision, by the way, you don't have a belt on, do you, Brad? Oh yes, he does.
Oh yeah.
That's the one thing we want to remember is when you're a therapist and if you're doing this, is safety comes first. And so I always have a belt on them. I'm always close. They talked about being close to a wall so they could hold on to that, but I don't really like that idea. They'll just fall against the wall then.
Sure.
So I'd rather have that I'm going to be close and can hang on to them.
Feet are shoulder width apart.
Shoulder width apart is fine, yep. All right, if they're able to stand for the 2 minutes, you can actually skip the next one, which is measuring their balance in a chair. But let's pretend that you didn't pass this one, Brad. Yep. So we're going to go ahead and have you sit. Scoot forward a little bit on the chair. And please sit with your arms folded for 2 minutes.
This is number 3?
This is number 3. Again, variations on this. If you, if you don't pass it, you maybe can do it for 10 seconds, right? Okay, now standing to sit, which is kind of a weird order, but go ahead and stand up again. And I want you to please sit down, and again, we're looking at, to see is he able to do so without using his arms. Good, and that's a flop actually, and that's gonna, he's gonna lose some points based on that. Let's go to number 5. Now you're gonna have 2 chairs. You're gonna have a chair with arms and a chair without arms. And I want you to transfer, you can start with either one actually. You can start, once you start, you're gonna transfer to this one over here. And I noticed you used your arms there, and now you're going to go back again. And again, in both cases, he used his arms. You can try to use it, try to do it without using your arms. All right, now you're going to go ahead and stand up, Brad. And we're going to have you stand with your feet just normal width apart. And you're going to see if you can stand with your eyes closed for 10 seconds. Yeah, you can face this way. Again, I'm close. Again, how many points he's going to get. Needs help to keep from falling. I would say this, you're able to stand 10 seconds with supervision if you're swaying. So, all right, now standing unsupported with feet together. Now, Brad, on your feet right now, with a lot of people, what we have found, if you're in the clinic a lot, there's a lot of people that can't put their feet all the way together, can they, because of their knees.
Right, if they've got their knees valgus or their knees are
even varus too.
Yep.
So if that means if they're bowed in or bowed out.
Their knees touch before their feet hit.
Right.
Like
so
this.
If they can't touch, the first thing you try to do is maybe see if they can put their heels together like that, because sometimes they can do that. Otherwise, you just put them as close together as possible. And we're going to see if they can do this for 1 minute. Okay?
And on all these, if you're not able to meet the requirement, you can read through the level of points they get, and it'll describe to you
Sure.
where to check and get.
By the way, this is a video not only for professionals, but it's also, if you have a family member that's at a high risk for falling, or that's been falling, you might go to your local therapist and say, hey, could you do the Berg test on them?
Exactly.
And that way you're going to kind of know what they're all testing when you do it. So, all right, reaching forward. Now we get to reveal the yardstick, Brad.
We have more than just the famous PT here.
Yeah, famous.
We have.
All right, so what Brad's going to do is he's going to line up so that his fingertip or knuckles, one of the two, whichever one you want, Brad.
I'll go
Okay, he's going knuckles, and that's right on the number one of the yardstick. And I want him to reach forward as far as possible without, you shouldn't rotate the trunk.
Right.
Rotate your fingers should not touch the ruler. And obviously you shouldn't lose your balance either.
And feet squared off.
Yeah. Have we seen all this okay? Yeah, I think so. It looks good.
Okay.
All right, Brad, why don't you go ahead and reach forward as far as you can.
You get kind of wobbly here, Bob.
And if he goes past 10 inches, which he is doing, then he gets the full 4 points. Very good, Brad.
All right.
All right, now you're going to pick up an object from the floor from a standing position. And usually we like a slipper, because that's obviously something very practical, and then quite often you're going to see a person doing that. And you can see we have the shoe there. And again, I would want to be very close to the patient here when you're doing this one. I might even have a hand on the belt, to be honest with you.
Sure, you bet. I would
And
too.
go ahead and have them bent forward. Pick it up. Good. If he needs supervision or if he's unable to pick it up, there's different variations on how many points he's going to get. Very nice, Mr. Heineck.
Thank you, Mr. Schrupp.
As you might have noticed, we don't have our camera person today, but we're working on it.
Yeah, we can do this by ourselves, Bob. We are good.
All right, the next one, Brad, go ahead and stand up. All right, now I'm going to show you what to do. You're going to turn completely around in a full circle. So I'm going to have you stand, and this is one you should demonstrate to the patient. I just think it's the best way to do it. Turn all the way around, pause, and then turn all the way around the other way. Okay?
Okay, so
what we're
which
looking
direction
for,
I go first?
either way.
Okay.
And what we're looking for is, can he do it in 4 seconds or less? Now, if he does one direction in 4 seconds or less, he gets 3 points. If he does both, he gets 4 points. Then you pause and you go the other direction.
And if they reach out to touch something,
Yeah, obviously they're going to lose some points.
Yeah.
All right, the next one is we're going to now use the step stool. I'm going to go ahead and jump on the camera here, but I'm going to also demonstrate this one to the person first. And you want to just go down real quick, Brad?
All right.
Now what they have to do is 8 steps in 20 seconds. So 1, 2, 3, 4, 5, 6, 7, 8. And I would demonstrate it first and then have the person try it, which I think we don't need to have you try it, Brad, because
Right.
you just saw it. So
And that's a 6-inch step?
a 6-inch step, yep.
Okay.
Okay. Looks good. All right, then we're going to have you stand unsupported, Brad. Oh, this is one too. Can I just describe it to you?
Sure.
Because I'll take the camera again, Brad. You're going to stand with one foot in tandem in front of the other. Why don't you face one direction, Brad?
So it's going to be...
You want to face that way?
Yeah, I'm going to do it both ways.
Okay.
This way,
Yep.
so you can see that, and
Yeah.
then from the side view,
Right.
like you're walking the line.
Yeah, and it's right in front of the other. Now, if you can't do that, the next thing would be is if you could put one foot ahead of the other, off to the side even a little bit. Yep, just 1 foot ahead of the other, that's it.
Staggered.
Yep. Do you want to do that to the side again, Brad, or not? You want to show that to the
Oh,
side?
I see what you're saying, yeah.
Yeah, like that, okay? And the other, next, and if he's not able to do that, the next step would be if he could just take a small step ahead. Like that, exactly. And if he's unable to do that, then it would be that we have to actually help him take the small step forward, but he still can hold it for 15 seconds.
So you're saying actually physically move that foot
I would
forward?
say maybe even, you know.
Just to balance,
Yeah,
yeah.
balance you to get you, help you get there.
And once I'm there,
Once you're there, but you can hold it for 15 seconds. All right? Then the last one is standing on one leg.
oh,
Either leg, and what you want to make sure with this is when he stands on one leg, that he's not holding the leg up against the other one for support.
so we want it out suspended, but not touching.
Right.
Yeah, that helps when you get the touch.
Now, I'll go back up here again. Now, that is it. That's the test. And, all right, Brad, so that was the test. On the next video, we're going to interpret the results of the test, Brad, because it's kind of involved. I don't want to add it to this video.
But you get a score 0 to 56.
0 to 56, yeah.
And those numbers, we'll tell you what those numbers
Each one
mean.
means something, so you want to look at the next video for the interpretation.
Alrighty then.